بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about cardiac calcifications, differential diagnosis with some examples. There are common causes and less common causes and rare causes but important. Most common pitfall in misidentifying which anatomical structure is calcified. Cardiac calcification more in dialysis patient. Common causes of cardiac calcification involving the coronary artery, involving the mitral valve, involving the aortic valve disease, aortic valve. Coronary artery calcification appear as curvilinear parallel lines, most commonly in the proximal coronary arteries and at the vessel branch point. Amount of calcium correlate with the amount of coronary plaque, but not degree of stenosis. Presence correlate with the risk of future cardiac events. Here we see left coronary artery calcification at its proximal origin and calcification of the left anterior descending artery with segmental narrowing and non-plaque calcification, and we have calcification on the ascending and descending aorta. The descending aorta slightly dilated compared to the ascending one. Here there is calcification of the circumflex artery and the left anterior descending artery. Extensive calcification. Also incidentally, there is calcification of the left and right main bronchus and dot calcification of the descending aorta. Here we see another patient with calcification on the left coronary artery and calcification in the LAD, left anterior descending artery, and calcification in the diagonal arteries. And there are some non-calcified plaques causing narrowing of the vessels. Here another patient with extensive calcification of the left coronary and LAD and the diagonal branch with non-calcified plaques also noted. Mitral valve calcification, there is calcification, we call it annular calcification, associated with mitral valve insufficiency. Valvular calcification suggests stenosis, most often due to rheumatic heart disease in early life. Annular calcification is present in about 35% of elderly patients, and it is commonly seen in female and commonly seen in female above 65 years of age. And these calcification associated with mitral regurgitation, and they are usually trivial asymptomatic. Calcification of the leaflets also cause mitral stenosis. Here we see the location of the valves, and this is the tricuspid valve, and this is the mitral valve, aortic valve, and the pulmonary valve. And here the tricuspid valve anteriorly, mitral valve posteriorly, and aortic valve in the middle, and the pulmonary valve superior to the aortic valve. And here we see a patient with large heart with atherosclerotic changes of the aorta and annular calcification of the mitral valve, and we see it C-shaped calcification, and this patient has stenosis, also can be has asymptomatic or mitral regurgitation. Here another patient with mitral valve calcification, annular calcification, and we see the calcification. It looks like C-shape, but also can be O, or can be C, or can be J-shaped calcification. Here, this is another patient with J-shaped calcification of the mitral valve, annular calcification with patient with osteoporosis and increased dorsal kyphosis. Here, CT scan, axial cut of this patient with mitral valve disease, calcification of the mitral valve, and enlargement of the left atrium. Here, another patient with calcification in the mitral valve and also calcification in the aortic valve. Patient has stenosis, aortic stenosis. Aortic valve calcification burden correlates with the stenosis severity. Bypass valve, young patient coexistent with coarctation, degeneration more than 60 years old, risk factor for coronary atherosclerosis, rheumatic heart disease, coexistent mitral valve stenosis more than 35 years old. Here, patient with calcification on this lateral chest X-ray of the aortic valve, and the patient has a critical aortic stenosis. And here, this is another patient with a CT image with calcification of the aortic valve, dense calcification involving the aortic valve cusp. This is the cusp, and this is the cusp, and this is the cusp. And calcification also correlate with the severity of the stenosis. Less common causes involving the pericardium, myocardium, and other cardiac valves and chamber. Pericardial calcification are usually associated with constrictive pericarditis. Here, this is just X-ray patient with after sternotomy, and there is calcification involving the pericardial curvilinear in patient with constrictive pericarditis, and here this is sheet of calcification involving the pericardium in patient with constrictive pericarditis. Here, this is another patient with constrictive pericarditis, extensive calcification seen involving the pericardium, and the patient has also effusion and increased dorsal kyphosis due to osteoporotic changes. Here, a patient with the calcification of the pericardium seen here and seen here, and also the patient has minimal calcification here. Also, there is a right-sided pleural effusion. Here, another patient with more calcification involving the pericardium with effusion, bilateral effusion, and collapse consolidation of both lungs, and calcification of the aortic valve. Myocardial calcification indicate prior infarction. Myocardial fat will likely to be present. Here, patient with calcification at the apex of the heart prior to myocardial infarction, and you see the epicardial fat to differentiate the calcification of the pericardium from the calcification of the myocardium. And we should also examine the patient motion to see if it is wall motion abnormality or there is no wall motion abnormality, and here also there is some thickening and minimal pericardial effusion. Here another patient with myocardial calcification with curvilinear calcification due to myocardial calcification on the left ventricular apex. Also, the patient has pacemaker. Here another patient with calcified ventricular aneurysm on the BA view with pacemaker, and this is the calcification in the CT scan involving the pericardial apex, and the calcification projected over the left cardiac border and extended to the interventricular septum, and the overlying myocardium is thin, and the patient has arrhythmia. Here another patient with calcified myocardium due to previous infarction located anteriorly in this lateral chest X-ray. Other cardiac valve calcification and aortic valve calcification, most commonly due to rheumatic heart disease, mitral and aortic valve will likely be calcified. Pulmonary valve most commonly due to congenital pulmonary stenosis, arterial calcification associated with arterial dilatation, severe arterial dilatation. Rare causes mass involving the heart, and these either due to chronic thrombus, arterial appendage involving the arterial appendage or adjacent to the infarcted myocardium, metastasis, history, patient has history of primary tumor, and arterial myxoma. We should look for characteristic location and attachment. And here, this patient with lateral chest X-ray with calcification, curvilinear calcification involving the left atrium in patient with left atrial myxoma. Thank you very much for listening and hoping to see you soon in another talk.